Contact tracing is a fundamental element of global public health. It is the way we understand how a virus spreads, and it's the way we stop a virus spreading. This is a tactic used in the poorest countries in the world and the richest countries in the world at the same time. It is basically step number one in making sure that a virus gets stamped out. The interesting difference about this outbreak is that we now have an amazing amount of technology necessary to do contact tracing on a mass scale and at a scale that we've never even contemplated before. We're all walking around with little computers in our pockets, and those computers are talking to each other, and they know how close we've gotten to various people. So if, say, you or I contract the virus, hypothetically, we could alert everybody else who's been in close proximity to us within the last 24, 48, 72 hours, maybe a week or more, that they need to now watch themselves for symptoms. That's great from a public health standpoint, but of course it raises huge privacy concerns, especially because we don't know who would be tracking that data, who would be responsible for it, and how they would use it. In this era of hyper-partisanship and anger at government and our institutions, you can see why that would be a serious problem and one that's going to need to be debated before anything is actually implemented. On the other hand, there are ways to do contact tracing that are much less technological. Simply calling somebody up on the phone and talking to them about their day. Who did you interact with? Who were you around? Where did you go? At what point? And then alerting those people sort of in a longer and clumsier way maybe, but one that ensures more privacy and doesn't involve your cell phone.
The way that I think contact tracing is kind of coming out in terms of discussion, it's scary. And there's a lot of, and the groups that mistrust government or surveillance, people of color, folks that have, either libertarian or right of center kind of points of view, and even women, as we see in the polls, are concerned about, and even older people, it's interesting in the polls, seem to be concerned about, contact tracing. And I think that's largely because it's not been very well understood what it means, what it's going to be like on just a person-to-person level. I think the basic idea is that somebody calls you up or comes to you and says, hey, we noticed that you've tested positive for COVID. We'd really like to know who are the people that you've actually spent a lot of time with, not just casually interacting with, pass by. That's a lot of people, but just you have spent a lot of time with that could have gotten COVID. And as a courtesy, would like to let them know. And by the way, we just want to check that you are doing the best things that you can so that you're not exposing more people. And what support do you need in that process? And so it's this skill, it's a people skill. And I think that's what people really have to understand, is that there really isn't a app that can do all of the part of the people stuff. What we do need digital apps for is to make that process of the people stuff easier. I think the idea of a big surveillance network coming down, and figuring out where everybody's moving down to the second, and how everybody's touching each other in this country. I mean, those are really kind of surveillance state fever dreams. And it can't work in this country. It shouldn't work in this country that way. And it ultimately doesn't work best for people, because people need to talk to somebody they trust so they can get the help they need, help the people in their lives. And you need digital technologies to just make that easier, like anything else we do, in the country.